My name is Amanda Jelinek, and this is my chest assessment video. I'm going to start by scanning the room. Alright. Before entering my patient's room, I would check the chart. Once I enter, I would perform hand hygiene and wash my hands. I would also provide for privacy by closing the door or shutting the curtain. Then I would approach my patient. Good evening, Mr. Perez. How are you doing today? Good. I'm Amanda. I'll be your student nurse, and I'll be assessing you. What brings you in here today?
Check that.
Okay. And can you just verify your name and date of birth with your wristband for me?
Marco Perez, 7988.
All right, and thank you very much. And have you experienced any pain?
No.
No? Not any history of pain either? No? Okay. I'm going to start at the top, starting with his skin and hair. Looking at my patient's skin, it is true to ethnicity. His hair, texture, and color are also true to ethnicity. The distribution of his hair is appropriate and it is distributed evenly. On his skin, there are no signs of any macules or lesions, no wounds or scarring. He does have tattoos along his upper extremities and on his neck. I'm going to do a Turgor's test. Shows his skin is elastic and that he is hydrated. Next, I'm going to go to his neck. I don't see any distension in his jugular vein. I am going to have him lay down and do a 45-degree angle to test that. So if you want to lay down on the couch real quick. And as he's laying down, I don't see any distension in the jugular vein, and he's set up at 45 degrees. And no distension in the vein again. And if you want to sit back down on the chair. Next, I'm going to palpate his carotid artery on both sides. And that is a 2+ bilaterally. Next, I am going to auscultate the carotid artery. So just take another breath. I am going to use the bell side of the stethoscope. And I'm going to do the other side. And there were no signs of any bruise. Looking at my patient's facial expression, it is relaxed. There is no signs of any use of accessory muscles. He's not showing any signs of respiratory distress. And now I'm going to move on down to his chest, his anterior chest. Do you want to take your shirt off for me? Thank you. And looking at my patient's chest, it is true to ethnicity. It is warm to touch, dry. There are pink undertones. There's no scarring or lesions. Watching him breathe at his pulse, his aortic pulsation, which is at the 5th intercostal space, mid-clavicular line. There's no heaving or lifts as he's breathing, which is good. And now I'm going to start by palpating his chest. let me know if there's any tenderness. I am feeling for any lumps. No tenderness? No. Then I'm going to start and percuss the chest wall, starting at the second intercostal space on each side and moving down to the fifth rib. And let's do that on both sides. And the sound is resonance, which is normal. Next, I am going to auscultate the chest wall. And I have you take a breath every time my stethoscope touches. Start at the second intercostal space. Down. And both sides. And I didn't hear any wheezing or crackling. The lungs sound clear and all lung fields bilaterally. Next, I am going to have you turn around. We're going to do the back side. Looking at my patient's back, the skin is still true to ethnicity. There's no lesions or scars or marks, no macules present. The skin is still warm and dry with pink undertones. I am going to start by palpating the back as well for any lumps or bruising, any tenderness. Any tenderness with that? No. I am going to palpate, or percuss, percuss. Starting at C7. This is the scapula. Right about here is T7, and we're going to go down to T10. Right about here. Start here. And on both sides. Alright, and the sound was resonance, which is normal. Next, I am going to go ahead and auscultate the chest wall. That makes time to touch. And there was no signs of any wheezing or crackling. The lung field sounded clear bilaterally. Next, I am going to have you, I'm going to test for the tactile hermitis. So I'm going to have you say 99 every time I touch. 99. And the vibrations were normal. Next, I'm going to have you take a deep breath. And that shows the lung expansions were symmetrical. Looking at my patient's chest, His AP diameter is a 1:2 ratio, which is normal. No signs of any barrel chest or anything like that. I am now going to have you turn back around. And now I'm going to auscultate the 5 heart sounds. We're going to start right sternal bound at the second intercostal base. This is aortic. And now we're going to move to the left sternal bound at the second intercostal space. And this is pulmonic. And move down one space to the third. This is third point. And now we're going to move down to the fifth intercostal space. Still left sternal bound. That is the tricuspid. And then we're going to stay in the fifth intercostal space and move to the mid-clavicular line. And that is the aortic, or the mitral. And there were no sounds of any murmurs. The pulse sounded normal beat, regular. Now we're going to move on to the extremities. Can you hold your arms out? Looking at the upper extremities, they are symmetrical. There are no signs of any bruises or lesions. There are tattoos on both extremities. The color is true to ethnicity and the hair is distributed evenly. I am going to feel for the brachial pulse on both sides. And that is a 2+ bilaterally. And now I'm going to do the radial pulse. And down this way. And that is a 2+ bilaterally as well. Looking at the extremities, I don't see any signs of edema. I'm going to have you do a finger grasp type. And can you push my hands? And can you pull my hands? Alright, and there's no signs of any weakness there. And now if you want to put your hands out, I'm going to test your cap refill. And his cap refill looks like it takes about 2 seconds, which is normal. Now we're going to move on to the lower extremities. Can you put your legs out straight? Looking at my patient's legs, they do look symmetrical. They are true to ethnicity. The hair is distributed evenly. There's no scars or lesions on here. I would, if necessary, check for the femoral pulse up here. I am going to start with the popliteal pulse, though, on both sides. And I'm going to move down to the posterior tibial pulse. Move it down here on both sides. And the dorsalis pedis on both sides. And all of those seem to be about a 2+ and regular. Bilaterally. I don't see any signs of edema on his legs or any bony prominences. I am going to check the cap refill on his toes. And they do look to be about the same, about 2 seconds, which is normal and good. Now, if you want to close your eyes real quick and tell me what you feel on your feet as far as sharp or dull. Alright, and that seems to be normal. Now can you put your legs out straight and push put them up, raise them up. And then can you push against my hands and push, there you go, pull them. Alright, and that seems to be normal, no signs of weakness in his feet or lower extremities. After doing this assessment, I would make sure to document all of my findings properly. And that's it.